It's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today I'm going to make another video about white spot lesions. I think I made one in the past about the opalescence product, and I'm blanking out on the name of it. I am an orthodontist, so I don't do this procedure. This is a procedure that maybe I'll refer a patient back to their general or pediatric dentist for the treatment. I fundamentally believe that a white spot is a baby cavity, and cavities should be done by the patient's general dentist. I like to stay in my lane, so I really have never done these procedures. I've only read about them, heard about them, and I talk to doctors that do them. I've probably had patients where I've kind of caused them inadvertently, not purposely, but I mean, the patient had poor hygiene and these things happen, and maybe my management of the hygiene wasn't as ideal as it could have been in the past. But in any case, I'm very familiar with white spot lesions, and I definitely have had a lot of questions about it. Now, keep in mind that my videos are meant for doctors to learn more about procedures, and they're not meant for consumers. Although you're welcome to listen to it if you're a consumer, it's going to probably be way over your head. So my recommendation is if you're looking for a doctor who provides these services, you can always give them, or even if your own dentist, I was probably willing to provide this service. It's not a hard procedure, and it's not an expensive supply to purchase, and they probably never knew about it. So you could just give them the link to this video, and maybe they'll get inspired and be willing to help you out with that procedure. Usually it's an additional fee. I don't believe it's usually covered by insurance, but that's really up to the general dentist and how they can bill it. So it's it's kind of a cosmetic procedure. So what is a white spot? Well, there's a couple things that cause white spots, okay? You can see here, there's white spots here. If you see them kind of square like this is usually caused by braces, because there's the brace, right? You can kind of see that, you can see that. That's caused by braces. That just means the patient had poor oral hygiene during the braces. Maybe the dentist could have managed it a little bit better. Maybe the dentist shouldn't have rushed to put the braces on. So let's talk a little bit about that. Let's talk about day one. Braces aren't even on yet. Oh no, let's go back to what causes them. So we talked about them caused by baby cavities, poor oral hygiene. It's the beginning of a cavity. It's just kind of like a scar. It's a scar that won't naturally reverse. So a procedure needs to be done. It's a little bit of a weak enamel. But some people also have white spots that are due to something called fluorosis. So if you have the white spot since birth, then it's fluorosis. It's just, or it could be due to perhaps a child had a high fever or was on a medication when those teeth were being developed. You can get brown spots or you can get white spots do that. So if it was something that was on the tooth when it erupted when the child was 7, 8, 9, 10, front teeth, that was probably, those teeth were forming and were mineralizing when the child was either a tiny baby or in utero, depending on how advanced the child was with their dentitional age. So that was due to, like I said, either medication or a high fever or a severe illness, or even it could have been a traumatic birth. All these things can happen that can cause scarring on the teeth. I know that sounds crazy, but these teeth are mineralizing when you're in utero or when they're a tiny baby. And incidents that happen then are going to show up later on your teeth. Crazy, huh? But that's the truth. So that's white or brown spots. If it's a new white spot, then it was caused by poor oral hygiene. Most commonly during braces, but it could just be, if you see it more at the gum line, it's due to just poor oral hygiene in general. If you see it in a square form, it's due to braces. We're seeing that a lot less with Invisalign and clear liners, because usually it's easier. They can take it off to brush and they don't have to worry about floss threaders and little proxy brushes and all that extra doodads to get things clean. So the ones that are caused, but it's important to know, and we don't always know as dentists what it's caused by, right? So that's feedback you need to give to your dentist, because if it was genetic or due to an illness as a baby, it's probably going to be harder to treat because it's been there a long time. And plus, that's not caused by the weak enamel. That's actually just caused by inconsistent enamel that made it that color. So that's probably either going to have to be restored, most likely, or perhaps you can do some whitening, and sometimes they even things out. So we don't always know the right way to treat it because we don't always know what caused it, right? So that's the part of the reason why I like to bounce it back to the general dentist, because a lot of times restorative ways are going to have to feed into it, or in-office bleaching, and these are all things that I don't do in an ortho office. So that's why I want to get started. You have to know what caused it. So beyond that, I'm trying to think of what else. So there are a variety of different things. I mean, obviously, first thing you want to do is get a good cleaning. If you've had braces on, I wouldn't rush as soon as the braces come off to go ahead and get a procedure done to reverse it. There are a variety of different procedures by some companies. In any case, I wouldn't rush because sometimes it gets better over time just on its own. You can also try something called MI paste, and I don't even know what that stands for, but it's a remineralization paste. You can Google it, MI paste. I believe that is prescription, and it's something that can be dispensed by a general dentist or by an orthodontist to help remineralize those areas. I would try that first because it's pretty much a very low cost procedure that can be dispensed. Whitening could be done by the general dentist as well. Again, I would wait a few months after the braces come off before jumping into the whitening. But those would be my first line of attack. And then after that, you could try something else. There's a variety of different products to help. I think one of the newer ones, well, not new, but that's really gotten good is Icon, is one of those ones. Again, I don't do this, but it is a procedure that is done in the office. You do have to either put a rubber dam on. That's definitely something that I don't, because you can't touch the gums. Or, you can either use an actual rubber dam or you can use these kind of liquid rubber dams that you put on, but it definitely is not something that can be done at home. So this is what I want to get out. There's a lot of you who are trying to look for, at home, do it yourself, DIY. No way. You will burn your gums if you try to do this. You do not have the right tools. You don't have the right methods of isolation. You need to have air water syringes, rubber dams, and things like that. Please do not even think you can do this yourself, because I know some of you are thinking you can. So we're not even going to go there, okay? So it's going to involve a process of cleaning the teeth, and then mechanically what we're doing with the Icon is we're abrading the teeth, taking off the surface layer, and then allowing a special mixture of resin to go down into the tubules and kind of block and prevent the demineralization from getting worse. And in doing so, it makes the surface harder, it makes it more resistant to decay, and makes it look better. You can repeat the procedure multiple times, and you can check it as you go to see if you're there yet. So there's no guarantee, and if you have a variety of different little white spots, some are fluorosis, some are, we don't even know, some are due to the braces, it might not all adjust, and it may not adjust evenly. So I would say have low expectations on this procedure. Don't expect it to look perfect, which is why, again, I want a general dentist to do it, because sometimes we're gonna do this and then afterwards we're gonna put a thin veneer on, snap a restoration, maybe a thin layer of composite over it, just to kind of make it look better. So definitely it should be used in conjunction with some restorative treatment for the most part. And I think that will definitely help. So just, things to keep in mind. And just to remind you, I think I mentioned the whole trauma thing or molar incisor hypomineralization is called MIH. That happens before the tooth erupts. We kind of talked about that. The actual term for that is MIH, molar incisal hypomineralization. So you'll see it at the incisal edges of the top teeth, as well as you might see it on the cusp tips of the molar. I think I have that on one of my canines. It's just a little white spot. But I've always had it ever since I was little. So that was probably, if it's on a canine, it probably was an issue that happened when I was younger, not a baby, but 2, 3, 4, something like that. So I'm trying to think of what else I need to tell you. I don't know what they're gonna charge for this procedure. Not sure, not usually covered by insurance. Don't expect perfect, you might get improved. Don't rush to do it, right after you get your braces off. Give it a few months. Try some of those other procedures we talked about first and see how those go. But ultimately, no, you're not stuck with modeled teeth. There's definitely things that can be done, and it will make the teeth stronger. So keep that in mind. And if you have, brown spots that are due to hypermineralization or fluorosis that cause brown stains on the teeth that don't clean off with a cleaning, those may not change with this procedure. So we might be fixing the white spots on the teeth, but not the dark spots on the teeth. So keep that in mind as you do it. I think if there's anything else I need to tell you, for the most part, no, I think that's pretty much it. But that's how Icon works. Definitely you should take it to your general dentist and ask them if they do the procedure. If they don't, try Googling, Icon, dentist near me, and see who offers the Icon procedure. Or you can even try to contact the distributors of that and see if they know of any dentist referrals in their area. Sounds like a smart thing to do. But I think for the most part, if you take this video to your general dentist, it's a really easy procedure. I think they'd probably be willing to do it for you. If not, if they're not willing to, find someone who will. So, all right, thanks so much. So let's get that done. Take care.